Hello and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. I am physiotherapist Meghna Dave, founder and CEO of HealthQ Rehab and a chief physiotherapist here. And today I am here to talk to you about foot drop, a very disabling condition for a lot of people in this world. So what exactly is foot drop? Why does it happen? And what is the solution for this problem? We are going to discuss all of them in today's video. So make sure to watch this video till the end. Let's begin. Friends, foot drop is not a condition, but it's a symptom or it's an outcome of some other condition. That's why it is a symptom or sign of a problem that could be either a neurological problem, it could be a musculoskeletal problem, or it could be following an injury. Hence, if you are experiencing foot drop, it's very important to identify the cause behind it. There is always a reason why a person will experience foot drop. It will never happen that foot drop will just happen without any reason. Hence, it's important to understand it. Basically, what happens in foot drop is a person have inability to lift the foot against gravity, due to which whenever a patient or a person is walking, he will end up bending excessively the hip and knee joint but won't be able to bend the ankle as much, and the foot will stay dropped down, and that's why the name has come foot drop. Mostly during foot drop there is weakness in the muscles around the ankle, which are also called as plantar flexor muscles. Mostly there is weakness around the ankle, and the muscles which are weak are called as dorsiflexor muscles. Dorsiflexor muscles are responsible for the lifting of your ankle joint, and whenever there is an injury to the nerve, due to which the muscles which are controlled by this nerve are also stopped or is impaired functioning, and a person will experience foot drop. As a result of this, the patient have a deformity which is called as equinovarus deformity in medical terms. So it's as simple as that. The foot stays like this, and this deformity is called as equinovarus deformity. Also, sometimes this is called as steppage gait, because the walking pattern of a person experiencing foot drop is very typical, where there would be excessive bending or lifting of the hip joint, of the knee joint while a person is trying to walk. But there would be very limited bending of or else lifting of the ankle joint that will happen. There is always a risk for this person to injure the toes as he or she is unable to lift it, and that's why the person will exaggeratedly bend or flex the hip joint and the knee joint during this gait. This increases the risk of fall, risk of tripping, and risk of injury for a person, and eventually this impacts the quality of life and functional independence of a person, and that's the reason it's important to identify and work on it. Now, what are the causes or reason why a person experiences foot drop? Well, this can be categorized in three categories. Number one is an entrapment syndrome, which you can say if a nerve is getting compressed, the nerve which is responsible for our ankle lifting action, if that is getting compressed due to some pathology, then it would be an entrapment syndrome based foot drop. It could be due to a neurological disorder, or else it could be due to traumatic injuries. In all three of cases, the problem will be same, which is foot drop, but the reason or cause behind it would be different, and that's why the solution or treatment for that will also be different. So whenever a person experiences foot drop due to a entrapment syndrome or nerve getting compressed between two structures, this condition would be an entrapment based syndrome foot drop, right? Now, what are the conditions which are causing foot drop due to this? These common conditions are prolonged pressure on the nerve due to sitting, or else let's say if a person is immobilized or is bedridden for a long period of time, there is prolonged pressure falling on the femoral nerve, or else the nerve which is responsible for your ankle lifting. This compresses the nerve for a long period of time, causing foot drop. The second common reason is wearing of tight cast. Sometimes a person has developed fracture or some problem due to which a cast has been worn. Now, if this cast is very tight, then it will also cause compressive pressure on the nerve, which would eventually lead to foot drop. At the same time, if the person has developed some sort of space occupying lesion or some sort of cancer or metastasis has happened, at that time also there would be a chance of development of foot drop. Even people who are suffering from sciatica, at that time, if sciatic nerve is getting compressed or entrapped between very important muscle of our thigh, which is called as piriformis muscle, at that time also what will happen is there would be this foot drop. And lastly, lumbar radiculopathy patients might also develop foot drop in severe situation. When it comes to the traumatic causes or the reason why injury is the cause behind foot drop, these situations or conditions are simple as spinal cord injury, fracture of the leg bone, dislocation of the kneecap bone, and ankle sprains or ankle inversion injuries. At the same time, there are some of the neurological disorder which could also lead to foot drop. The most common one is stroke or is paralysis. If a person has developed stroke either during early age, whatever it is, right? But at that time there is a possibility of foot drop. Even children who are born with cerebral palsy have spastic diplegia or dystonia, or even quadriplegic children might experience foot drop. But there is also one situation which are autistic kids, right? Now they don't have foot drop but they mimic foot drop. They develop this habit of walking on their toes. At that situation it will not be called as foot drop, because for foot drop to happen there should be an active inability to bend the ankles. So in that case it will not be considered as foot drop. So as you saw, there are many causes behind this foot drop, and based on this cause itself the management is decided. So what is the management of this foot drop? Well, the management basically lies in correcting the underlying cause, for which knowing the underlying cause is important, and that's why it's important that if you are experiencing foot drop, please see a doctor as soon as possible. Your doctor will take your history, will do physical examination, will write you some tests like CT scan, MRI, and even sometimes blood tests to identify the cause behind it. Once the cause is known, then the management is decided. And the management usually is either a medical management which is combined with physiotherapy. Physiotherapy plays a very crucial role in foot drop management. At the same time, in certain situations, surgical correction is also needed. At the same time, sometimes muscle relaxant is also required if there is over-contraction or co-contraction or spasticity kind of issues also present. So based on the cause, everything would be corrected. But physiotherapy is one thing which has to be done no matter whatever is the cause of foot drop. Now what does physiotherapy incorporates? Physiotherapy basically incorporates working on correcting or minimizing the muscle tone related issues. So muscle can be either too floppy, flaccid due to a nerve injury, or else if it is a brain related lesion, at that time spasticity could be an issue. So working on reducing the levels of spasticity or improving muscle tone is the goal of physiotherapy. At the same time, physiotherapy focuses on correcting the positioning of the foot by advising of splints. So there are a lot of belts and splints that would be advised to you to correct your posture, followed by which there are a regular exercise program which focuses on improving mobility, improving the flexibility of the muscles, and improving the strength of muscle. Eventually, the goal is to make the person as functionally independent as possible. It's important to work in the right direction and under guidance of the right therapist. And that's where HealthQ Rehab can help you. HealthQ Rehab is a condition-specific rehab-based program where you get rehabilitation online with the help of expert physiotherapists. Every physiotherapist who is in clinical space at HealthQ Rehab has done their masters in different domains of physiotherapy, and we make sure that you get treatment only from them. So if you are someone who is experiencing foot drop and need help or looking for help, feel free to reach out to us. We would be definitely able to help you. On that note, I'll end this video here and I'll see you in another video. Thank you.